It's not free market completely, but it's quasi-free market. Certainly a lot freer than what we have right now because we have a mandate. Remove the mandate. Let government provide an alternative, not a mandate, but an alternative. And if they want to go ahead and get aggressive on price, they'll don't kill me for saying this, they'll put the lowest insurance price on the board.
Okay, so I've now watched that clip 5 or 6 times. I'm still not quite sure what Fox's Eric Bolling is proposing, but I think it's an alternative to the current healthcare law that sounds oddly familiar. You see, back during the heated debate over the law in 2009 and 2010, lots of liberals were making the case that having a mandate to buy private insurance might result in an insufficiently competitive market. And so maybe the government should come in and make sure there was a basic option available for everyone. Of course, conservatives of the Eric Bolling ilk didn't exactly rush to endorse the public option.
If you have a public option and you eventually get to only one option, then there's no choice.
It will be a death blow to private choice.
This program of government option that's being touted as being this panacea, the savior of allowing people to have quality health care at an affordable price, is going to kill people.
It's going to kill people. So, is Bolling now pro-public option? Well, somehow I doubt it, because you have to understand the context for what he said. He's using the idea as a rhetorical weapon to attack Obamacare. He's less interested in how such a program would actually work than in just using it as a hypothetical to bludgeon the actual, imperfect, complicated law that currently exists. And this is basically all you need to know about the vaunted conservative alternative to Obamacare, a creature as pristine and magical as a unicorn and precisely as extant. Because right-wing alternatives to liberal-backed universal health care only exist as rhetorical tools to attack actual liberal proposals. Here, I'll give you another example. In the wake of the Congressional Budget Office report projecting a reduction in the total hours Americans work due to Obamacare, conservatives, who have not been mischaracterizing the findings, have been slamming the law for disincentivizing work for some workers. And this conversation has occasioned a discussion among conservative and liberal wonks about the unfortunate fact that in America, health insurance is tied to employment. And boy, that doesn't make much sense.
Well, should we have more people working? Do we need more leisure? Well, if you weren't subsidizing job lock, well, we could leave that largely up to individual choice and not be trying to play sort of chess masters with that.
This is the issue that we have, right? We have healthcare tied to employment. And one of the things that's been fascinating about watching the Affordable Care Act debate play out is that I've seen a lot of conservatives and single-payer lefties like myself, I think, arrive at the same point, which is let's disentangle the two. It turns out there was a bipartisan bill that would have repealed the tax subsidy, the huge tax subsidy we have right now for employer-provided health insurance that's in the law, and it would have gotten rid of it as a way of reforming health care in the United States and getting to universal coverage. It was called Wyden-Bennett, after Democratic Senator Ron Wyden of Oregon and Republican Bob Bennett, who were its main backers. Democrats ended up abandoning the idea in favor of Obamacare. But you know what happened to Bob Bennett for his sin of co-sponsoring this legislation? This.
Government health insurance that pushes you out of your current plan. Citizens can only buy health plans approved by the government. Job-killing tax increases on employers.
Yes, Bob Bennett was one of those so-called establishment Republicans purged by a Tea Party grassroots for the sin of betrayal, in large part because he favored, quote, a government takeover of health care, even though he actually voted against Obamacare. He was dumped by the state's GOP convention, ultimately replaced with Mike Lee, who now proudly waves the banner for the Tea Party in the Senate. Bennett's main problem with the grassroots was that he had committed the unforgivable sin of proposing, yes, a conservative alternative to Obamacare that he actually seemed to want to make the law. And of course, there's the obvious fact that the entire mandate and subsidy model that is the architecture of Obamacare was first implemented by Republican Governor Mitt Romney in Massachusetts, and it was based on a position paper from none other than the Conservative Heritage Foundation, which floated the idea in 1989, and which was later used, wait for it, as the basis for a conservative alternative to Hillary Care. In fact, something to the left of Obamacare was the official Republican alternative during that healthcare battle in the 90s, endorsed by politicians from Chuck Grassley to Newt Gingrich. And when you press conservatives about this fact, they say something like, well, that was then and this is now.
In 1993, in fighting Hillary care. Virtually every conservative saw the mandate as a less dangerous future than what Hillary was trying to do. It's now clear that the mandate, I think, is clearly unconstitutional, but it started as a conservative effort to stop Hillary care in the 1990s.
You see that? It's now clear that it's clearly unconstitutional. Back when we supported it, it was better than Hillary care. But now that we have it, now it's unconstitutional. Okay, here is the basic, inescapable fact that underlies all this misdirection and nonsense. There are two dominant political coalitions in American life. And one of those coalitions has made universal health care a priority for a very long time. And the other has either ignored it, fought tooth and nail to stop it from happening, or occasionally made noises about what they would do if they could. But you will notice that the last time Republicans were actually in power, they didn't pass universal health care. And the time before that, and the time before that. So when you read the headlines about the new Republican Obamacare alternative, keep this in mind. The most magical quality of the mythical creature called the conservative healthcare alternative is that it disappears the moment you try to actually implement it.